Welcome to Age to Perfection, the podcast that celebrates the beauty of every stage of life. Welcome to Age to Perfection, Jamie.
Thank you.
I finally got you in my chair. Now, the only reason I've gotten you in my chair is because I did bribe you with a Sancerre. I don't like red wine. I don't like white wine. I only do red wine. But I like this one because it's not too buttery like a Chardonnay. It's not too crisp like a Pinot Grigio. It's that perfect balance of all of it.
The thing about white wine when you're doing videos, it's good for your teeth.
I know. That's true too. But I love a Sancerre as a white wine because it's perfectly balanced. And I think today's topic goes very well with the whole theme of perfect balance, right?
I like that.
So when I went down this whole rabbit hole of, wellness and why we need wellness, it's like you can look like $1 million, but if you don't feel like $1 million, it's useless. And I think it was one of our patients that came in and said, well, up until now, I had 10 problems and it was great because I could fix my 10 problems. But now when I'm not feeling well, I have one problem. And that one problem hinders me from doing anything else in my life, right? Yeah. So I'm going to bribe you to get a little tipsy. So you give us all of the information and all of the juicy pearls on how to balance our hormones.
Okay.
Right?
All right.
So getting old sucks. Like it really, really, really sucks.
It does.
But I think everybody has that oh shit moment a little bit too late. Like, that I woke up one day and like, oh shit, what happened to me? So what did happen? What is happening in my body at 40s?
Okay.
What's happening in my 40s?
So in the 40s, we are having some hormonal changes. And the reason it's difficult and kind of hard to just put your finger on is because there's so many fluctuations. So you're having your estrogen levels are fluctuating, your testosterone, your progesterone are a little bit more predictable, like they're going down like a little bit more predictably. But estrogen is really fluctuating a lot, and it's really hard because we think of the symptoms of like hot flashes, night sweats. That's the symptom everyone knows, menopause. So if we're not having that in our 40s, we think like, well, I'm just tired, or, well, I didn't sleep well last night. And so we don't think of things like joint aches and pains and not sleeping well and like low libido and mood changes, anxiety, depression. There's so many things. And we think like, well, I'm just busy with the kids. I didn't sleep well. You're like, you don't want to be intimate with your husband. You're like, I'm just sick of but there's, all these things, and those are really occurring. They're really tightly tied. I won't say it's responsible for everything, but is really tightly tied to the hormonal fluctuations we're having. And of course, the overall trend is, going down.
And I think that's one of the reasons why people don't have that oh shit moment until it's too late. I feel like that.
Yeah.
By that point, you're so far gone down the fork in that road that we have to do some serious cleanup work.
There's a lot of work to do then.
Because it is these small compounded symptoms. And they're the small compounded symptoms that we love to chalk it up to everything but ourselves. We will blame everything but ourselves.
Yeah.
And I think that's where we need to start first. So let's break down each of the hormones, because I think I really want, there's so many podcasts out there. There's so many books out there. There's so many experts out there that are giving advice. And I really want our patients, our Houston, Sugarland crowd to understand it on a basic level.
Okay. So I feel like the first thing noticeably that we experience, and we don't necessarily realize it, but is the drop in testosterone. So even you feel like,
but I'm a girl.
I know. We have testosterone too.
Oh, I know we do, but
much smaller quantities than we do than, men. We produce in our ovaries. We need it. It's very important. In about mid to late 30s, our levels start to decline. So we'll say,
I haven't felt any symptoms in my mid 30s.
Are you telling the truth?
That hip pain did not start until at least 39. Okay, Jamie?
Okay, I was gonna say by the time you're in your like early 40s is usually when you start to experience joint pain. A big part of it is like you're getting a little bit more fluff, a little bit less muscle. So like you're putting in the work at the gym, but you're like,
no, my problem was I was putting in the work at the gym, and then I wasn't able to perform at superhuman levels like I would like to perform at.
Are you sure you're not having any testosterone problems?
No, you tell me you took her blood.
Yeah.
I think that was one of the first of it. And again, like I said,
for sure.
Oh, I'm stressed out today. That's why I didn't hit my mile mark or whatever that I'm using to use my markers. Okay, fine. Testosterone.
Yeah. Testosterone.
Take away is it the same for guys?
Actually, yes. So guys will experience it like around their 40s. But
so we get it first.
Yeah, I would say we get to it first. Guys are probably about the same time, actually, but we're just typically as women, like we are just a little bit more kind of like in tune to ourselves, and men kind of don't realize it until they're like really dragging. So like they really are feeling bad. So for men, yeah, it's fatigue.
Or until it starts affecting their libido. Then they notice.
Yeah, if the libido or sexual function is, affected, then they, notice. But they, are really cranky. Again, like they're fluffy. They're not, maintaining muscle and putting on muscle the way they used to. So I guess what I'm saying, men wait longer. Like I think our hormone levels decline kind of at the same age, but men just wait longer to do it.
Is it because we have all those other hormones?
Probably. I think that I think that helps.
It's that man. So I think when I first started going down and learning about hormones, and let me tell you why I started the hormones. Okay. I am so thankful that I am not classically trained as a derm or a plastics, because my goal was always wellness. And the reason I made wellness my goal was because in my previous lifetime, when I was doing family medicine, people would come to me and they would say, I feel like crap. And then I would draw their blood. And then I would tell them, but look, your blood looks perfectly normal.
Yeah.
Like, so you're fine. And then they would come in and say, you know what? I don't have energy. Okay. I don't sleep at night. Wonderful. Here's a little bit of Ambien when you need it. Go ahead and go to sleep. And then, well, I had Ambien. Now I can't sleep. So I really need my coffee in the morning. If I don't, then I get a headache.
Yeah.
And then it was just this cycle. And you can chalk it up to one or two people being a little bit too in tune to their symptoms.
Yes, for sure.
But when you have 15 and 20 and 30 people coming in to say, I don't feel right, but everything on paper looks perfect. I was like, there's gotta be something.
Yeah.
There has to be and unfortunately, we don't learn about this in our classical education. So the first class that I went to, first and foremost, came out of that class wanting all of my money back for my medical school education. Like, I want the $1 million that I spent getting a degree, I want it back, because I didn't learn half of the things that I need to learn.
Yeah.
But one of the key things that I really brought home was our hormones, cortisol, thyroid, estrogen, progesterone, testosterone, all of them are hormones. And they described it as, it's like a symphony. And if one flute player is off by half a note, it throws the whole sound off. So if testosterone is that first kind of ripple effect, what's the next ripple effect?
Typically progesterone. And that's when the sleep issues come in. So progesterone we kind of call like nature's Valium and hits your GABA receptors. It's a very calming hormone. So when you start to have decreases in that, you're feeling like now you have anxiety. Now you're on edge. Now you can't sleep. Now you are really irritated with your husband. You went from kind of irritated and now you are very irritated with your husband. So yeah, I mean, and so now you're very irritated. You can't sleep. You're working out. You're not getting out what you're putting into it. You're gaining weight. I mean, it's a
domino effect. Okay, then we talked about testosterone. Testosterone gives me my
energy, libido, strength,
muscle.
Yeah, muscle. Overall, like well-being.
Okay. What does my progesterone? We said that's my happy drug.
Yeah, it's very calming.
My Xanax, my Ambien, my I sleep. I'm a very nice human being.
Yes.
I'm not a nice human being these days. Maybe I need a little progesterone.
Yes.
Estrogen.
Estrogen is everything else that makes us female. It's everything. It's our hair. It's our skin. It's the way we feel. It's our sleep. It's our mood. It's our bone strength. It's our brain health. It's everything.
So if all of these things are diminishing, but they're diminishing at a microscopic level, which one of the three really tanks before you have that, oh, I really need to go get this done?
I think it's
or is it all gradual?
No, I think it's gradual, and I think it's really different for everyone. Like, I definitely have a group of people that will come in and say, like, okay, I'm ready. I just started having hot flashes last week, like, or last month. I just started having hot flashes.
Can't live like this.
I can't live like this. I'm ready. And then getting to talk to them more and digging like in a little bit more of their symptoms. And they're like, oh, well, shoot, I should have done this, 5 years ago. They're like, well, I didn't know. I didn't know that I was ready. And so, some people don't know until they have that like typical hot flash night sweat, situation. Some people I feel like are keyed into it a little bit sooner, where they just know. I see this a lot like with my weight loss patients when they come in and they're just like, we start to talk and they're like, yeah, you know what? I'm really not feeling good. Like, I'm really not feeling right. Like, I really, when they really start to look at it and think about it. So I guess I feel like a lot of times it isn't, people don't know. Like, people don't necessarily have that like, oh shit moment until it's really far down the road. But it's like they almost don't know how they're feeling until you kind of point it out to them. Does that make sense?
Yeah, it really does. I want to touch, but before we continue, I want to touch on, you just said your weight loss patients. Mm-hmm. Obviously GLP-1s are blowing up right now. Mm-hmm. We have and thank you for making it a very healthy, weight loss program. And we really try to mitigate all of those side effects very, very well. But, why is some of that weight gain happening? And I feel like and I've heard you tell people, you know what? I don't think you need a GLP-1. I think I'm going to put you on a little testosterone. Mm-hmm. I'm like, but they want weight loss.
Yeah. I mean, like we've said a couple of times, like testosterone is responsible for muscle loss, right? You're losing muscle, you're packing on fluff. All of this is stressful. So with stress, comes increased cortisol levels. With age comes, even if it's just a little bit, and even if it doesn't show up on your labs, but a little bit more insulin resistance. I feel that all right here, cortisol here, estrogen, insulin here. You feel that all kind of in this situation. And then again, like, you're not sleeping, you're not feeling your best. Like, you're just not feeling your best. I mean, if you're not sleeping, you're not functioning.
People say if you don't sleep, you're literally, it's the equivalent of like you're driving after 3 drinks.
Right.
Is 3 or 4 drinks if you don't.
Something like that.
That's the mental function of someone without sleep.
Right.
Yeah. So, yeah.
It just takes a toll. Like, I mean, like physically and mentally, that really takes a toll, which, I mean, we know stress is, you gain weight from stress. And so it's stressful.
It is. And you were talking about estrogen and how it does all of these other things. And we all talk about, so let's go back to the symptoms.
Okay.
Hot flashes, joint aches. I just don't feel good. But I think there's a lot of symptoms out there that people don't realize. This is due to your hormones and not just because what are some of those symptoms? Like, I know in the people you shove my way, it's like, well, my skin was doing this and now all of a sudden it's super dry. I went from like an acne prone teenager to looking like a snake, right?
And that's a good point. And I get that a lot. Like, I could be seeing a patient for a laser or injections or whatever, and they're maybe not even my hormone patient. But as we're doing their treatment, they're like, man, like can you recommend a new moisturizer for me? Like, my skin's just so dry, or like I'm finding like having to do like more filler more often, or, my laser more often. Then we get to talking a little bit, like, you lose a ton of collagen production when you lose estrogen, like a ton.
Okay.
Yeah, a ton.
So why? Because I think one thing that most of our patients don't understand is they think, okay, I'm done having babies. I don't need my hormones anymore. I'm good. I'm good.
No, you need them for the way you feel, the way you look, and the way you age. 100%.
Yep. And so when we go into our classes, one thing I didn't realize, and yes, I went to medical school. Yes, I did really well. I did not know that you had estrogen receptors like
everywhere
in your brain,
your eyeballs, like everywhere, everywhere.
So I don't just need it for my uterus and my ovaries.
No, it's everywhere, literally everywhere.
And I think that's one of the biggest reasons some of these other side effects. One big one I feel is the mental capacity.
Yeah. I was gonna say the same thing. Yeah, it kind of starts with like, where are my keys? Why did I come in this room? Like, then like it just gets worse from there. And then you're like, I don't know.
Hello, Alzheimer's.
So, yeah. No, but I mean, the brain fog thing is real and it's terrifying. I mean, I have women come in that are seriously like terrified and they're like, I can't function. Like, I can't function at work. I can't remember what I'm doing. And like,
some of us have jobs where we really pay attention.
Yeah. And there's stress. And then but add all everything else that we just talked about too. I mean, it's horrible. Like, it is horrible.
Okay. We covered what hormones do on a basic level. We covered why we start depleting and all these. For those of our patients that, are not like me, by the way, guys, I pretty much hound Jaime every time I wake up in a bad mood to be like, do I get drugs now? Are you going to give me my drugs now?
She does.
Because
I give her some.
When are you going to let me start, or when do you let people start?
So it depends is the answer. It depends on your symptoms. It depends.
I already know
that is true. It depends on your symptoms. It depends on.
Well, I have symptoms now. I don't sleep well. I can't remember shit, and I'm cranky.
Okay, so for you, someone in your situation, okay, you are 41.
Mm-hmm.
You are still cycling regularly.
Mm-hmm.
You claim to be cranky. And can't sleep. And I know you have a lot of energy, but you say, you don't have as much energy. No, someone like you, I would say testosterone for sure. Now let's run some lab work. And I will never say to someone like, let's look at your lab work. Oh no, your lab work shows you're not in menopause. Bye. I will never say that. Or I will never say, oh, it's been less than a year since you had your last period. Bye. Like, you're not a candidate. It's not true. Like, you are absolutely a candidate for hormone therapy. You're not a candidate for estrogen yet.
Okay.
Because you're still cycling. Estrogens can be really tricky to put in there when people are cycling. Because remember, estrogen levels are
even if I'm done having babies.
Yes, 100%. And for the sanity of your coworkers, you definitely cannot have any estrogen right now. Because of the fluctuations that you're having. The troughs that you're having in the estrogen, like when your estrogen dips, can be improved. Like, you would feel a little bit better with taking estrogen. But the peaks that you're having, oh Lord. No, it will make it so much worse.
Okay.
So I guess it's kind of like the art that comes with it. After doing it, for a long time, then you realize you just get to know, most women in their 40s are ready for testosterone and progesterone.
And this, guys, is why AI will never, ever, ever replace us. Okay. Ever. Because a robot will not be able to tell you, hey, you know what? I know Susie so-and-so.
Yes.
And this is not her normal. And even though her lab showed this, like that human aspect that you were talking about, it comes with years of doing this.
It does. And it comes from listening to your patients too. Like, it isn't like you're not just, Dhara, Patel, I'm looking at your lab work and say, well, you look fine. I mean.
And that is the mistake we were all making. Mm-hmm. That is the exact mistake we are all making in traditional medicine is here's your symptoms. Here's a drug.
Bye. Yeah.
Don't come back. See you next year.
Yeah.
So unless you have diabetes or heart disease or on your deathbed, I don't need to worry about it and I don't need to mess with you.
Yeah. Yep. Agree.
Okay. So let's talk about someone that's already on HRT.
Mm-hmm.
Okay. Hold on. I'm going to backtrack a little bit. Let's talk about treatment. What are my options? Okay. Obviously you always tell everyone it's customizable. So break it down for me. Okay. What is customizable?
Well, first of all, the hormones that you're going to take, of course, are customizable. Which ones are appropriate for you at this time. And then the route in which you take them. That's where we have a bunch of different options. And this is where it becomes kind of like a trial and error kind of thing. We're going to get to know each other pretty well. Like, we need to know, like, are you the type of person that can apply a cream every single day to your upper inner thigh? Can you put a cream on every single day? I cannot.
You're going to call at me.
I can do my whole skincare routine twice a day, but I cannot put a cream on my leg twice a day or even once a day. Like, I just can't. Like, I'm not doing it. And I know my limitations. But some women are like, no, that's totally fine. I'll do the cream. Capsules, there's capsules. Progesterone's always going to be a capsule. So, that's one. Progesterone is not absorbed well through the skin. So it's always going to be a capsule. Estrogen, like I said, you can take it topically, you can do injections, you can do it orally. There's pellets. Pellets are great.
I love the idea of pellet.
And I love pellets too. So pellets it's a little injection.
Explain pellets real fast.
So pellets, it's a little incision in the buttock, and I just insert like a little piece of long grain rice is what it looks like, which is actually compressed bioidentical hormones. They've actually been around for a really long time. I know they've been popular just probably in the last like 5-10 years or whatever, but they've actually been around for a really long time. So the beauty of that is you don't have to worry about it. Like there's no injections, there's no creams, there's no, I mean, you still have to take oral progesterone, but you don't have to worry about it. Like you stick it in 3-4 months, you're fine. For men, actually, they're even better. They get like 5 or 6 months.
They always get the better end of the deal. What are you talking about?
Oh, don't worry. Their incision's bigger. For sure. But yeah, I mean, I love pellets. I don't love to start people out on pellets. I really like people.
Tell me why.
Well, I love pellets, right? Like they're convenient. You put them in, they're yours. We're done for 3 or 4 months. And then if you don't like them, they're still yours. I can't go in there and get them out. You know?
And honestly, I think as women with the modern medicine that we have for birth control, we are spoiled. Like we're spoiled with our implantable devices, and we're spoiled with our
totally.
So we don't
have time to take a pill or put a cream.
We don't want to have the time about it after either, right? Yeah. A quick sidebar is you mentioned bioidenticals. We only do bioidentical hormones for anybody that is listening. If you go to CVS or Walgreens and you go to buy estrogen, that is Premarin. Premarin is made from pregnant horse urine. Mm-hmm. Your body knows it's horse. It is not what your body produces. And for those of you who don't know, bioidentical hormones, their molecular structure is the exact same that your body produces. So this is where we take the side effects out of it. This is where we take the complications out of it. And this is where that study that everybody loves
the WHI study.
Let's touch on that for a brief second.
So the WHI study was in the early 2000s. It was this massive study, and it was to look at the health benefits of taking hormone replacement therapy. So there have been a whole bunch of like observational studies or so, meaning like people have noticed that women taking, hormone replacement therapy, their cardiovascular disease, was reduced. They had less osteoporosis. Like they were just aging better. So they did this massive study. So they have one group who took, and these are all synthetic hormones. So one group took estrogen only, and one group took estrogen and progesterone, the synthetic. And then when there was, the control group. So fast forward a little while, they find, oh no, we have to stop the study because people are developing, there's more cardiovascular disease or blood clots and breast cancer. Holy moly, we have to stop this whole study. So before they analyzed the data, they really just kind of stopped the study. Everyone became, fearful of hormones. It got really big, like in the media. Everyone's like, oh, okay, no more hormones that cause cancer. And that literally is still what some people think, even though that was 20 years ago. So since then, there has been multiple studies done. I mean, I'm talking like hundreds of studies done looking at...
Which, by the way, I don't know where everybody else is trained, but for full disclosure, me and Jamie are trained by like international doctors. That these are not just studies that are done in the US. These are studies that are done in Japan and India and like all over the world.
Mm-hmm. So in the group that took estrogen only is where it gets really interesting because... From the study, it's estrogen that has a bad rap, right? Like when you hormones, like what do you think is bad? Like when you're like, okay, no, estrogen was not the problem in this study. So the estrogen only group had a lower incidence of breast cancer.
Really?
Yes.
But we're always taught do not give estrogen.
No. So they had a lower incidence of breast cancer. Okay. The estrogen and progesterone, again, these are synthetics. Okay. They had a very, very slight increase in blood clots and breast cancer, okay?
So this is still my Premarin horse urine.
And the synthetic progesterone.
Yeah.
The moral of the story is that it's the synthetic progesterone. That was the problem. It's not the estrogen. It never was the estrogen. It's the synthetic progesterone. That was the problem.
Yes.
Yes, that was the problem.
Now there's so many studies showing synthetic progestins, which, by the way, guys, that's what's in your birth control.
Yeah. But see, I don't think it's too bad in birth control.
Okay.
I think
I wanted
when you were younger. Yeah. I think when you were younger, taking birth control, it doesn't have the same, it's not the same risk profile. Like for a younger woman versus someone who's like in their 40s or 50s, it's different. And I think many people would say they would rather have their daughters take the birth control than become grandmas at the age of 40.
Agreed. So then why do people hesitate?
Because of that study. It was so popular in the media.
Okay.
So popular.
It's not just that study. All right. Let me tell you, I do this for a living, and my mom walks into this building for 2 reasons: to exchange food or to exchange children. That's it. I cannot even convince her to do it because it's not just the study. I think a lot of it, and especially if you're depending on what your cultural background, your ethnic background, it's everybody has this whole, but that's how God made us.
Yeah. Yes. There is definitely.
That's how we're supposed
to
be.
It's kind of the older generational thing, for sure. And I have women come in all the time that are like, oh, my mom told me.
What do you tell them?
My aunt told me. Like, yeah, my mom totally do that. Why would you do that? This is modern medicine, girl. Like, do not do that. We're not doing that. We're not doing that.
And I like to tell my mom, like, Mom, you can't remember anything anymore. Yeah. I need to still be able to keep my kids straight tomorrow.
Yep. Yeah.
So
it's very hard for people to unlearn something, and especially doctors, nurse practitioners, everyone. It's very hard to unlearn.
I think as women, we also get all of our knowledge from the previous generations, right?
Yes, exactly.
You should do this when you have your period. These are the things for when you're pregnant. These are the things after. And
this is where you suffer.
This is where you suffer. And guys, unfortunately, with modern medicine and with the way everything is going right now, once your ability to have children and reproduce to contribute to society is over, we don't give 2 shits about you. Like we do. We do. But modern medicine.
Yeah. But it's getting better.
It is definitely getting better because people like me and you push for it to get better because now we are selfishly invested into it.
And there's more funding going towards, education.
Now there is because we're driving that funding.
I agree. Yeah.
But up until now, it was like, you're done having kids. Bye. I don't need you anymore. Yep. So there were no studies done on women's heart disease later on in life. No studies done on women's Alzheimer's risk factors and all the things that are going into it. So we don't study the overall human health of women.
Well, we do. We do now.
Now we do.
Yeah, we do now. We do. And there has been a lot of studies since then. It's just that the WHI study was so big and the data was so poorly interpreted and it was so publicized that it was so damaging. I mean, I think it was probably the most damaging thing to women's health, like in general. I mean, it was that damaging. Even though there was like literally hundreds of studies since then showing that is not true. That is not true.
Take a sip of your wine.
Oh boy. Okay.
We're going to talk about, and I promised you we wouldn't do this, but I'm going to do it anyways. We're going to talk about.
How do I do this?
I don't know.
Why am I here?
Because you love me and you love to educate our patients.
Yeah.
We're going to talk about the C word.
Oh, yeah.
We're going to talk about cancer.
Yeah.
Now, I want to preface this part by saying the way we practice it, we make sure we follow our state board guidelines.
Yeah.
And that is exactly how we treat our patients. But let's put that aside for right now.
Okay. So there's actually some really interesting research being done on breast cancer and hormones. Okay. They are using testosterone to treat breast cancer.
No.
Literally. They are taking testosterone and they're injecting it into breast cancer and watching the cells die. Yeah. Now remember also that I told you from the WHI study, the estrogen only group,
they did fine.
lower incidence of breast cancer. Lower. Significantly, like 30% or something.
Which, by the way, guys, we're not allowed to treat any cancer patients with the hormone. So, yes, we follow the board guidelines.
It's good to know.
But
it's
for those of you out there, it is fascinating to realize that all these studies are coming out and they're all saying it is okay to treat patients with cancer with hormones. And I think me and you have a patient that she's at this point, she's like, I don't want to live this kind of life.
Yeah, for sure.
Like, I don't care what my oncologist says. Just give me the damn drugs.
Yeah.
Because I don't want to feel awful. What is the point of living if I have to live with memory loss and hair loss and weight gain and my joints don't hurt? Yeah. And so I think one of the big takeaway points that I always tell my patients is the reason I want hormones, I do hormones, and I preach it all day long, which, by the way, if you only have money to do one thing or other, please don't come see me. Go see Jaime first. There is literally, it is useless to spend your money on the outside. if you feel like crap on the
Well,
inside.
I will tell you, if we think about the patients that we both see, like the ones that are on hormones and the ones that are doing aesthetics, and no matter which way they went, like either they were doing aesthetics first and then they started doing hormones or vice versa, those patients look 10 times better than the ones that don't. Because remember what I told you about the and estrogen? Because estrogen, there goes your collagen too. And think about when people are pregnant. What do their hair and their skin look like?
Oh my God, amazing.
Yeah.
I had like the best hair when I was pregnant.
Right. So when you are, at baseline, obviously you don't have as much, estrogen as you're pregnant, but that thing goes down.
And pregnancy braid.
Yeah, so it's even worse. Like when you get it works.
Did you know that 76% of women blame their divorces on menopause symptoms?
I am not surprised because I literally had patients that come in and they're like, I'm going to divorce my husband. They're like, I can't, he breathes and I can't, like, he chews, he comes home. But what's really sad, I joke about it, but what's sad about it is they're like, but it's not me. You know what I mean? They're like, but I don't feel like, you don't have to, like, I can't control. They're like, but I love him and I don't feel like this about him. They're like, it's like this other part of me that's like growing and I can't control it and I don't know what to do. And I'm either going to divorce him or he's going to divorce me. I mean, really, like, and it is, like I said, I mean, I joke about it, but like, it is sad.
And it does. And I think people don't realize, but hormones affect every single aspect of your life.
Yes.
You come in cranky with your coworkers and they hate you. You come in cranky with your husband and he's like, who is this banshee that walked into the door? And your kids are like, Mom, please go. Chill out. It affects your friendships. It affects your ability to control your temperature.
Yeah.
I mean, my God, I have to take a sweatshirt. I live in Houston and
it affects you. Like it affects you and your brain and the way you feel about yourself and who you are. When you start to question like who you are and like the way you're mothering and the way that, you're working and the way that you are like performing like as a partner and as a friend, like that's really like damaging, to like who you are to like feel like that.
Okay. What's the worst thing that can happen if I decide to do hormones?
The worst thing that can happen? Mm-hmm. I guess worst case scenario would be that you have an estrogen dependent cancer and we have now given you estrogen and it grows faster, which it depends on how you look at it, may or may not be the worst thing, because if you are doing your health screenings like you're supposed to be doing, it just means they're going to pick it up faster. Like you're going to get it one way or another. Like you're going to develop that cancer one way or another. Like estrogen and any of the hormones, they don't cause cancer. But if you have a cancer, it can make it grow faster. So I guess it just kind of depends on how you look at it. I mean, women that are on hormones are more likely to get their yearly mammograms and their yearly GYN screenings because you have me harping on you. Like, hey, did you do this?
She really did. She literally dragged me to my mammogram.
Literally went with her. Literally. So, I mean, I think that's a big one. Like if you are on hormones and you're not getting your regular screenings done and you have an estrogen dependent cancer and that you are now feeding an estrogen, that would be like your worst case scenario. But I really don't have anyone that I let get away with it. I mean, make them do it.
Good. And don't wait till your oh shit moment.
Don't wait that long.
Like I think if our listeners get anything out of this, it's don't ignore your symptoms. Mm-hmm. Start as soon as you can because those small things compound. Like it is not a broken bone that you put it in a cast in 6 weeks, it's gone. These are little microscopic changes that have added up. What did you say? Oh, God, we saw a patient with early menopause and you were like, well,
I don't know who you're talking. The one that looks amazing?
Yes. But you said something to her and you're like, oh, wonderful. Well, my 50-year-olds have been having bone loss and memory loss for the last 5-6 years, but you've been having it since you were 30. And you're like, that's going to be wonderful for you by the time you're 50.
I don't remember. But no, that's not who I was thinking of. Who I was going to tell you is we have this patient. I think we both see her. No, maybe you don't see her. I think I see her. She came in for weight loss, which she needed just a little smidge of a GLP-1, which did her very well because she's very active. She's physically active. She travels all the time. I had to double check her birth date. I had to come out and go to the desk and be like, hey, I think y'all put this birth date in wrong. No, it's not. There's not her license. She's 80. And do you know what I'm talking about?
I know. When you're out, you're like, holy cow, how does she look?
It's a walking advertisement for hormones.
I know.
She looks like she's about 60, no joke. And
I believe
vibrant looking. She, like I said, she travels all the time. She has a more like, active social life than I do. Like she's always like doing stuff. She hit early menopause in her 30s, and thank the Lord, her doctor put her on hormones, and they never looked like they went through the WHI, all that.
I'm so mad at you.
She looks amazing.
If I don't look like her, I'm going to be so pissed.
She looks amazing, and her bone scans, her DEXA scans, perfect. Okay. Like, she has no osteoporosis.
This is how we're going to end the podcast, okay?
Okay.
You're going to get up like you're somewhat, and I always tell my patients, I'm like, this is why I do hormones, because at 80, this is how I want to get up out of a chair. So you get up out of a chair like someone that is taking hormone replacement, and I will get up off of this chair like someone that is, you want to get up?
No, I'll get up like someone who's taking hormones.
Okay. And I'll get up like someone who is not taking hormones.
Okay.
Okay.
Tell me when.
Now, let's do it. Cheers. Thanks for an amazing podcast.
Thanks.
Hold on. Let me use my accessory muscles. Thank you for joining us for this enlightening episode of Age to Perfection podcast. We hope you enjoyed exploring how hormones influence every aspect of our lives and discovered practical strategies to achieve that balance. Remember, taking control of your health is a lifelong commitment, and every small step counts. If you love this episode, don't forget to subscribe to Age to Perfection on your favorites listening podcast so you can never miss an episode. Also, we'd love it if you could leave us a review and share this podcast with your friends and family. It helps us grow and continue bringing you valuable content. Until next time, stay healthy, balanced, and empowered.